The Institute for Family Health has designed and started implementing two substance use safety plans with the intention of reducing risk of overdose. Why we developed two safety plans was that we were acknowledging there are different pathways to accidental overdose, and we wanted to make safety plans that were specific to address the unique needs of those pathways. So one pathway is those who are currently using substances or medications which put them at risk of overdose. And another pathway is the increased risk that comes along with early recovery and relapse. So we designed two, the first being a harm reduction safety plan intended for people who are actively using substances or prescriptions illicitly or by prescription that put them at increased risk of overdose. This is very much like a harm reduction plan. It provides information about the things which increase risk of overdose, as well as providing harm reduction techniques. This is really powerful in engaging the patients. It acknowledges that we're going to meet them where they're at, and there is things that they can do to reduce the risk of overdose while still being actively using. The early recovery safety plan, intended for people who are not currently using but at risk of overdose with relapse. So this is very similar to a relapse prevention plan, and however, it directly addresses the increased risks of overdose that are associated with recovery. These can be very helpful during transitions of care, right? The increased risk that we're going to talk about in the next in the next element. Times like coming out of rehab, residential treatment, coming out of jail, or stopping the use of medication-assisted treatment as another transition, or other times which clients may stop using substances like pregnancy without really the intention of continuing abstinence. While developing both substance use safety plans, we wanted to be very conscious of our use of language. The safety plans are written in a narrative tone. It can actually be read to the patient, and it's used in a very patient-centered language. We included some focus groups of both clinicians and patients while we were designing this to make sure that the language was respectful and appropriate for the different stages of change. This was also intended that we would like clinicians and providers, regardless of their specialty, to feel comfortable to use the substance use safety plans. So not all providers have the same experience or comfort in talking with patients about substance use, and particularly we found uncomfortable sometimes in talking about relapse and harm reduction. So these safety plans are completed collaboratively with the patient and can actually be read out loud. They're available in both English and Spanish, and they are, once completed, saved in the patient's chart as well as provided to the patient and can be accessed by all members of the care team. Both of the safety plans acknowledge and are informed by the stages of change model. And what you will see when you look at the stages of change model is that recovery is depicted as a circle, not a straight line. So the early recovery safety plan also acknowledges risk of relapse, and by having this written, it is very objectively talking about it with clients. It's not taken, so that reduces the risk of the information being taken personally, like the clinician is judging the client's stability of their recovery, which can damage and be hurtful to a patient. It's written down in the safety plan. This is something we feel is important. We talk about it with everybody. So the early recovery safety plan talks about relapse and risks of slips and relapse. The harm reduction safety plan also talks about recovery. We're going to meet you where you're at, but if you're interested in getting help, we can also, that's great, and we're going to help get you the help that is best for you. So the plans together make a circle. An essential element of suicide risk safety plans is reducing access to lethal means. Now, what could that look like for a harm reduction safety plan, right? So it may be unrealistic to be asking clients to abstain from use, because this is exactly what we're giving them the safety plan for, that at this time they are unable to abstain from use. So approaching it from a harm reduction, providing harm reduction information, these are steps that you can take to reduce the likelihood of overdose, the risks of overdose, and then also providing overdose education as to what are the risks of overdose. Facilitating the access to Narcan or overdose prevention kits, naloxone medication in New York State is accessible by everyone in the state, has a standing order prescription. So assisting patients and clients in getting kits, however that is within your area. And in less concrete ways, providing and assisting with access to treatment is in effect reducing access to lethal means. Having assisting people and clients getting treatment decreases their likelihood of overdose, and in a way, in that way, a harm reduction approach to care, not kicking people out of the treatment if they are using, which is something that would dramatically increase their risk of overdose. So providing a stepped care approach to care, which we'll talk about during the treatment element. So this section is talking about engaging, and safety plans are an excellent example of engagement. Both the suicide risk and overdose substance use safety plans are completed collaboratively with the patient and the client together. They are also shared by the care team. Safety plans are only good if they're being used, and so at the Institute, these are shared across the care team, embedded in the electronic health record, and used at each follow-up visit. I'm also happy to share these with you. Just ask. We're very excited about developing and starting to use the substance use safety plans. I'd be more than happy to get you electronic versions of it that can be adapted to your organization. I'd love to hear your thoughts on them. And at the Institute, we're hoping to provide some research about how they're working. So reach out. I'm happy to share.